people. This morning we are all about the skin care. Kim Whitaker from the Center PC is here with tips for women in their 50s, and we're going to get to some of your Facebook questions in just a second. Kim, thanks so much for joining us.
Good to see you.
Good as always to see you. All right, now we're talking about women in their 50s here. What are the major skin concerns when you get into your 50s?
Well, your hormone levels are going to start to change because of menopausal issues. So
Sure.
you're having a loss of progesterone and estrogen, which causes a drop in collagen production. So elasticity is going to be an issue. Sagging, thin skin, skin thinning, also loss of oil production. So you're going to get drier. So you're going to have to compensate for these things that are occurring. And you can do that by choosing products that are going to really hydrate the skin.
All right, what are some other tips to kind of fight Mother Nature here and the ever-ticking clock that we're all just trying to race against?
Creamy cleansers, you're going to have to switch. Really hydrating creams with shea butter in them, or squalene, which is an olive oil derivative. You're going to see sun damage come out, capillaries are going to come out on the skin, and then your pores are going to become more visible. And then, you know, you want to look for those precancerous spots that are going to occur.
Okay.
So going to the dermatologist and having, you know, at least yearly body checks are
So you're saying
very
that
important.
needs to be a part of every
Absolutely.
50-year-old's routine. Now, we're looking at a couple pictures here, and can you kind of tell us, like, the difference, too, between what happened there?
Yes, those are twins, actually. One was exposed to the sun for prolonged, you know, decades, and the other one was not. And you could see the difference, that sun damage is out on the skin, you know, significant wrinkling, deep furrows, those kinds of things.
All right, so watching when you're out in the sun. Now, you do have some advanced treatments if any ladies out there are thinking about those.
The laser is going to be your option for really taking care of some of these more significant problems with the skin.
All right, now we do want to get to these Facebook questions because we just had some great ones. Thanks to all you ladies who wrote in, and gentlemen as well. Question from Whitney, who says she's had a problem with skin recently, small acne bumps on the forehead and shoulders and back. It doesn't seem to be like acne, and Proactive doesn't seem to be working so well. What should she be doing?
She could have what's called keratosis pilaris, which are little bumps that usually occur on the body, usually in the back of the arms, but they can occur elsewhere. A glycolic wash, like a multi-AHA wash that is going to take care of and exfoliate those little bumps is very helpful.
Where can she get those?
She can get those sometimes over the counter, so look for something with glycolic acid for the body.
Okay. All right. Good, good. Next up we have from Terry, what can be used to help with lines and wrinkles on the face?
Well, really, the best treatment is Retin-A. That is the only FDA-approved product for treating fine lines and wrinkles.
Okay.
So some of the over-the-counter stuff can make claims, but doesn't mean it's going to work.
Okay. All right. Now we've got another one here. This is really interesting to me. Tammy says that 2 of her 3 daughters itch whenever they take a shower. Are they allergic to the water?
Well, not necessarily allergic to the water, but they, you know, some of the elements in water can really dry out our skin. It could be they're taking really hot showers, or maybe they need to put a filter on their shower head to filter out some of the minerals and things in the water that can cause, you know, some skin itching and problems.
Fascinating. So go ahead and try that if you can. Maybe a filter will work for you. Kim, always such a pleasure to see you.
Good
Such
to
a
see
joy.
you.
You have a great day, all right?
You too.